Have a seat.
Thank you.
Oh, dear. Right, that's a big sigh.
Oh, yes. I was here last Tuesday.
Right.
That's with a UTI.
Yeah.
So I've had it before, but
Right.
this time was different. It was so painful.
Right.
So I came to the doctor, and then she prescribed for me some antibiotics.
Yeah.
And then she said between 2 to 3 days it should begin to clear.
Yeah.
So today was the last time I took it.
Yeah.
But I still feel pains.
So the urine sample that actually went to the lab, it didn't grow an infection. Okay.
Okay.
So,
So what's it then?
so, Dr. Bolam did dip it and it did show white cells. So any discharge or anything down below?
No, not that I know.
No. Any new sexual partners at all?
No, it's only my husband.
Right, okay, okay. Could you do another urine sample for me now?
Yes, I can do that.
Saying that. Oh, one last bottle. If you go and do that and then come straight back in.
Right, I'll do that now. Okay, thank you.
Okay, brilliant, thank you.
I couldn't pee much because I did before I came
plenty,
in.
that's fine.
The sample that the doctor took, she asked me to call the lab
Yeah.
to find out whether it's in. Are the results in?
Yeah, well, that's what I said,
Oh, okay.
that it's negative. When she dipped it, there were white cells in there and blood. Right, so there's 1+ of blood and 1+ of leukocytes again. So we'll send it off again. OK, if you jump on the bed, can I have a little feel of your tummy? Just pull this around. OK, so where's the pain?
Here.
A
Yeah.
little bit there. That's quite sore there, isn't
Yeah,
it?
yeah.
OK, you can pop your stuff on.
Okay.
Most of the time, when we treat a urine infection, when we send it off to the lab, we would expect to grow bacteria. People can have infections in their urine or in their kidneys without it showing. Okay. So I feel it's probably worth us treating you with some further antibiotics as you're still symptomatic. Okay.
That's fine, thank you.
There we go. I hope things improve. Drink loads as well. Yeah.
Thank you.
OK, but if it doesn't get better, do come back.
Thanks.
OK, no problem. All the best. Bye-bye.
Thank you, bye, bye.
What's on your mind this morning?
Right, I've got a history of osteomyelitis in my right ankle. A couple of days ago, I had a bit of a temperature and quite a bad headache. And I woke up this morning and I've got real bad pain on the inside of my right leg and sort of from the groin to the knee.
OK, you've got a history of spina bifida and you've got this problem with the right foot.
Yep.
There's a combination of orthopaedics and plastic surgery.
Yep.
Spina bifida is a condition that occurs in utero, in other words, when you're pregnant. It's a problem with the development of the spinal cord and its coverings. It can result in problems with muscle weakness as well as fluid around the brain.
This is quite sore down here as well, where I've got the muscle graft.
OK, and I'm going to just pop you behind the curtain here.
Yep.
I just want to have a listen to your chest and have a look at the leg. So, is it all right to call you Carl?
Yeah, of course it is.
She says, having called you Carl all morning. Oh, there we go. All right. Carl has a significant past history of osteomyelitis. This is a very serious condition whereby you can get an infection in the bone. We also have to bear in mind that Carl has metalwork in his leg, and this is a foreign body. If that gets infected, it can be threatening to the limb in the sense that he could lose that limb. OK, and there's pain in the groin, isn't there?
Yeah.
Does it hurt when I touch?
Yes.
OK, can you push up against my hands? Good, and on this side. Good. OK, I'll let you get dressed. Take your time.
OK.
Is it stopping you from doing anything?
Not really stopping me doing anything. It's just when I walk, it's just gets a bit painful.
There's no signs of any infection.
OK.
I think it would be a good idea to run a blood test this morning because we'll get the result fairly quickly. It may be worth just reviewing you back next week.
Okay.
And sooner if things haven't settled or if they're getting worse.
Yeah, all right.
Because of your past history, we're just extra cautious.
Yeah.
But often these things turn out to be just a muscular something or another in view of your
Hopefully it will
general
be.
orthopaedic history, you know? Things that would check you over.
Okay, thank you
All
very
right,
much.
that's not a problem. Take care.
Okay, all right, thank you very much.
Bye-bye.
Thank you, bye-bye.
Have a seat.
Thank you. Yeah, I was in hospital all of last week.
Oh dear.
Because of the DVT thing.
Right.
It bled everywhere.
Bled?
Yeah, I think it was a varicose vein on the
Okay.
surface of
Right.
that.
Yeah.
I was washing up and it just bled
Oh, dear.
everywhere.
So it was the bleeding that kept you in
It
hospital?
was the bleeding that kept me in
Yeah.
hospital and the swelling of my leg, and they said that the DVTs got bigger.
Have you got an appointment with the haematology doctors, the
Getting
blood
one.
doctors?
Yeah, I'm getting one.
Okay.
I'm literally waiting to hear.
Is there anything to see, or is it all covered up with
It's
the
all
big
covered
dressing?
up.
I'm
File.
not. Let me not look
Yeah.
now, because
Okay.
actually, as long as it's okay from your point
Yeah,
of view,
it's
the
all
nurses
right.
are going to look this afternoon. So if there's anything if I take the dressing down and
Yeah.
it causes loads of bleeding, then we'll have to get the nurses involved.
Also, as well, I haven't been on them for a while, but I was on citalopram. I feel kind of okay, but I'm kind of waiting to go down.
And was it depression that you suffered
Yeah.
with before, or did you get much anxiety with it as well?
Yeah, the anxiety's kind of gone.
And when people get depressed sometimes, they
Yeah.
get, other thoughts or other,
Yeah, I have been there.
more serious
Yeah,
kinds of
yeah,
thoughts.
yeah.
Has that drifted in, do you think?
Yeah, a little bit.
Let me just check. You haven't had any more suicidal
Not since being at home.
plans or
No.
hopes to die or anything getting so serious that it's got that
No.
bad? No.
Not since coming out of hospital.
What would happen if those feelings got worse? What would you do?
Normally, I lock myself away for 24 hours. In the past, what I've done, completely just lock myself away. Don't do anything. Don't allow myself to eat. Don't allow myself to go to the toilet. Nothing. And then I normally come out of it. Before, especially first year of uni, I drank a lot. Like a
It's
lot.
a common reaction or
Yeah.
way of dealing with it.
And a lot quickly. So like 3 bottles of wine within the space of 10 minutes, like a lot.
Gosh, that is a lot.
Mental health problems are really common, and young men suffering with depression is one of the things that we see very commonly in the surgery. William has suffered with on-off recurrent depression over the years, for which we've been supporting him. The natural feelings that you have when people first tell you about something really deep and personal is to empathise and do your best to be compassionate with them. And then the next stage is to try and move on and come up with some solutions to help them move forward with that problem.
So it sounds, this is obviously complicated, isn't it? What about any counselling? Are you having anything at the moment? I'm just going to
No.
look at see if I've got any past history here.
Because I know I was on 10 milligrams and they increased it to 20.
How long have you been on it for?
Oh, God. It was when I was in sixth form, so when I was 17.
Yeah. So you've been on and off it for your
Yeah.
mood for 6-8 years?
Yeah.
It does take between 2 and 6 weeks to have its full effect.
Yeah.
And starting off slow and building up is a sensible thing, because then there's less to come off later.
Okay.
Do you want me to organise some counselling for you or give you the details about that?
yeah.
Because that's one of the
Yeah.
other mainstays of treatment.
Yeah, that'd be cool.
And as I say, if anything changes or gets worse in the meantime, just let us know more urgently, obviously.
Oh, I do. Awesome. Thank
All
you
right,
very
nice
much.
to see you. Bye then.
Bye-bye.
Hello,
Hello,
I'm Dr. Bolam.
good to see you.
Right.
A week back, I was here.
Yeah.
I was suffering with every year almost a fever.
Okay.
Apart from that, I'm having asthma.
Yeah.
So it's getting worse and
Oh dear. Okay. All right. So you think this is really your asthma, or a combination of the
combination,
asthma?
yeah,
Okay.
because
All right.
it triggers with, asthma, it's in control
It's not in control at the moment, is it? Really?
almost every summer.
You always get a bit of a dip.
Starts with hay fever.
Okay. And then your
Ends
asthma.
up, last year I was been to the emergency, then my GP. He said, we'll try with antihistamine, which I'm trying over the counter.
Yes. Okay. So. Okay, so what you're wondering, I'll have a little look at you in a minute, but what you're wondering is whether you need the steroids.
Absolutely. That will be immediate relief and controls life.
Okay, well, I will anticipate we'll do that, but let's just check your nose. Okay.
Okay.
Can I just pop this on a finger? And you're not coughing up any spit? You don't think you've got an infection or anything?
Spit in the sense, white stuff sometimes coming. But
Yeah, but nothing green or not mucky looking? No. All right, OK. And what job do you do?
I'm an IT programmer.
OK, right. Can I have a little listen to your chest? Is that all right?
Absolutely.
Thank you. OK. OK. I'll wait till that's finished. You're a bit wheezy, aren't you?
Yes, absolutely.
Do you have a peak flow meter at home?
Yeah.
Might be better to stand up. Let's just have a look what your normal peak flow is. Do you know what it is normally?
I'm sorry, I don't remember.
I feel like coughing now.
It's not contaminated. I don't think it's contaminated.
I don't think you contaminate. I think it's psychological. So the last time you did it was 420. OK. I'll have a quick glass of water. Just blow it over that direction for me.
Oh, I just hold it.
That's better, I guess. No, 260. All right, so that's a bit lower than you were last week when you saw the nurse, all right?
Yeah.
OK. OK. I'll give you some... so the best you did there was 270. All right. If I was you, I think I'd be carrying water around with me. I think water would help a bit, wouldn't it?
Yeah.
Maybe we need to step up your treatment. There are options, but you think it's well controlled most of the year, and it's just bad in the hay fever season, really?
Season in summer.
OK. All right. Fine. I don't want to step it up permanently if it's normally all right.
Yeah. Thank you
OK?
very much.
All right.
Cheers.
That's a pleasure. OK. All right. Take care now. Thank you.
Thank you.
Bye-bye.
Hi.
Hi.
What's been going on?
I fell down a rabbit hole.
Oh dear, right.
My ankle went up. I heard it crunch and pop and...
Right.
So I've just been getting on with it, but it's not getting better and it, you know, I can't bend it. You know, like when you sit on your foot,
Yeah.
I can't do any of that.
OK.
So I think there is some...
And were you able to walk on it at the time?
Oh, well, it was a struggle getting home.
Yeah.
But yeah, I've just sort of like pushed
Just kind of
through
got
it.
on through. And what have you been using for it?
Nothing.
This was which day?
Right, 7 weeks ago.
7 weeks ago.
Yeah.
So what's brought you up tonight then?
Well, it's just not getting better.
Yeah.
I am going on holiday on Tuesday.
OK.
So I just wanted to check before I went.
Yeah, because I think, you know, if you did sprain your ankle,
Yeah.
which is what probably has happened, then it does often take months to get better.
Yeah.
Is it sore at all?
Yeah, it's more here.
Not round the back, though?
No.
Move it round and round.
It's there.
This is where it's sore, yeah.
Yeah.
That's where it's painful. Because that's the classic spot where you get a sprained ankle.
Ah, I
Is
can't
it
do
sore
that.
on your foot itself?
No, it's there. I'm gonna bend it.
What about in here?
Yeah. I'm trying not to cry.
But it's more in here rather than in there?
Yeah.
It's more in the over the foot?
It's all of it.
I mean, I think most likely this is just a nasty sprain that you've got. It can put people on crutches, so just because it's a sprain doesn't mean it's not serious.
Yeah.
And it does mean that it can go on for months. It can be worse than a break because actually the ligaments heal up less quickly. Because it's actually more over the foot, though, I think it is reasonable to get an X-ray.
Yeah.
I will arrange that for you to go up and just go and have that.
Drop in.
Yeah. Do you want some painkillers?
I've got painkillers.
You've got some?
Yeah. Is that just any day?
Yeah, 9 till 5,
Friday.
Monday to Friday,
9 to
so you can
5.
go up tomorrow.
Lovely.
And then why don't you give it a week and then ring just to get the results?
Yes.
All right.
Thank you so much.
Cheers then.
Bye.
Hopefully it will just,
I
there won't be
think
anything
so.
there, but if there is, then we'll do something more about it.
Thank you very much.
OK, bye.
Bye.
Yes, come and have a seat. People often expect a Chinese doctor with me.
Doesn't matter.
No, have a seat here anyway. I think you're a visitor. Are you visiting us? Or are you a patient here?
For the moment, I need to subscribe, you know, because I need the doctor.
You're up in Brown, and that means you're what we call a temporary resident, I think. But you're living here, are you? Are you going to register permanently here?
Yeah.
Where have you come from?
My father from Belarus, yeah. My mother from Greece,
Okay.
from Athena.
Yeah.
And I'm Danish resident. After the high school, I was a security officer from army, SWAT, you know, the special squad.
Yes.
You know, paratroops and other things.
Have you got any illnesses that we should know about that you've had before? Are you on any medication?
I was shot a lot of times.
Do you want to tell me a bit about it?
I was cut here. This is from 1986. This is from 92. I have another one here. I was shot here, and 48 part of metal was here.
Oh, yeah.
And take it out. But I'm perfect, no problem with this.
Okay.
The only thing what put me down, it's sinus. I have pain. It's sinus. Yeah. No. I don't feel good.
No. And you're not taking any tablets or medicine?
Today I don't take it nothing.
No, right. So is it here? Just right there.
Yep.
And then if I just take those off. So here's your other sinus. That's your frontal sinus there. And
I know it's facial sinus.
Yeah.
I know about this. This you have a lot of sinus.
Yeah, and
but
these
here it's about this one.
And these ones
not
are all
this.
right, are they?
Yeah. Malar sinus, it's okay.
Okay. Is there anything coming down your nose from up here?
Yeah, was yesterday some like yellow things, and in the morning blood.
Okay. A bloody discharge is very characteristic.
It's good if you
I'm just going to do your blood
go out.
Yeah, but it does make it very likely that your sinus is infected, so you have diagnosed yourself correctly, I'm sure. Okay. Relax a little and I'll just see what this is going to be up to. It's 184 over 104.
Because of pain.
Do you think? Okay.
I'm pretty sure about this. Okay. Because normally I have 137.
But I'll print you out an antibiotic to take for this. Are you allergic to any antibiotics?
No. I'm allergic for the stupidity. The only thing.
Take this, 2 today,
yeah,
and then 1 every day till you've used them up for a week. That should settle it down. You must now book an appointment for maybe 2 or 3 weeks' time to come and have your blood pressure checked again.
Okay.
And I hope you're better soon. Yeah.
Thank you very much.
Thank you. I hope to see you in 3 weeks.
Come on in, have a seat. How are you doing?
Bit better. Not much.
Right.
Financial side of things is slowly getting back together. I went to a job centre Monday. They've now decided until my court date comes through, I can go back on my ESA on the condition that I have sick notes to cover me.
So so it's an appeal for the benefits, essentially. That's what the court issue is. Yeah. OK. So do you need me to do a certificate today for that?
Yeah.
OK. So we're going to put drug addiction therapy on, because that's what I wrote last time. Yeah?
That and chronic pain.
Yeah. OK. Donna has had problems with chronic pain since her mid-teens and was initially prescribed opiates by doctors, and then she acquired more illegally. The script that she has from me is for a drug addiction therapy, but it is also treating her chronic pain. She could come off her opiate medication, and this might help some of her symptoms, like agitation, fidgetiness, but she has been reluctant to do this. So I'll print that off. And then your scripts, they are going to run out, aren't they?
Yeah.
So at the moment, you're on 16.8 milligrams altogether. Yeah? And what are your thoughts about that?
As it is.
Yeah? Mm-hmm. And are you using on top at all?
No.
Not needed?
Just, but I'm not doing it now.
Right.
Oh, I'm not doing it, I don't know.
Right.
I've had some really bad nights with my legs. It's not so much my knees, it's my legs.
Yeah.
I've got to the point now where I'm sat there in the night time and I'm crying where I can't sleep because I'm tired and I feel like I just want to cut my legs off or just do something with my legs.
So you went to the pain clinic and they really helped you with your pain management, didn't they?
Mm.
And you went and had lots of advice.
Like I said, I went on a thingy course, pain management course, to help obviously pace, manage. It's hard when you've got kids and that around you.
Yeah.
I do it every now and again,
My leg's been that bad and I've been that painful over days where I can't even get up out of bed where I'm hurting that much. I've just completely packed gymming altogether.
Yeah.
I am trying to get myself back up there.
Yeah. That would be good, wouldn't it? My feeling is that you're on quite a lot of medication. It would be best not...
I don't really want to go on anymore.
No,
I really don't want to add to the hurt.
I agree. And also, I'm not sure it really helps. The kinds of things that help are you taking a bit more control of things, isn't it?
That's what I'm trying to do.
And is your partner still being released in the autumn?
With a bit of luck, October.
Right.
17 weeks and counting.
Oh, really? OK.
I kind of really need him at home to help me.
Yeah.
I'll say some days is a struggle, some days I just haven't got it in me at all. It's like I'm constantly, I'm sitting, I cannot keep my legs still because they're constantly irritating me. Yeah, because it's still swollen.
Yeah.
They haven't gone down at all. The ibuprofen hasn't took them down at all. I'm still taking them, but...
I think it's likely to be a combination of the fact that you don't do as much as you did, walking-wise, and the reason why we don't all have swollen ankles is because we use the calf muscle to pump the fluid back up to our hearts, and when you do less, then it does make a difference, OK? It just kind of pools down the bottom, and it's particularly bad in the summer, usually.
Yeah.
So maybe before you go out, you need to sit down and do those stretches first, just to kind of relieve a bit of pressure on everything, yeah? Why don't you try that out and see if that helps? OK. Was there anything else today?
No, I've been sick note, that's it. That was my main problem.
Yeah.
Slowly getting there, slowly.
Good. OK. All right, Donna?
Yeah.
So I'll see you in early August or sooner if you need to.
Okay.
Yeah?
Yeah, that's fine.
Good. OK. Bye now.
Thanks.
Come on in, come and take a seat. Right, I'm Dr. Ahmed. How can I help today?
For about 3 or 4 weeks now, I've just been getting a flare-up of eczema.
Right.
And it's just not going away.
OK. And have you had eczema since you were a child?
Yeah, and it just flares up when I'm stressed and overtired.
Any reason why you're stressed at the moment?
Yeah, there's a few reasons, but they're things I'm dealing with, so work and stuff.
What work do you do?
I'm a ICU staff nurse.
Ah, OK.
Yeah.
How are they treating you up there?
Oh yeah, it's fine. It's just the type
pressures.
of work. Yeah, you get some sad cases in and infection more than you realise until you get home.
So do you have sort of strategies in place to switch off from when you come back from work?
I live with 10 people, so I switch off pretty easily when I get home.
There's plenty of people to talk to and things like that. I think that's the main thing, is to talk about it, because you're involved with those cases, aren't you? Do you know about Bristol Wellbeing Therapy? It's just an independent...
I've seen it on our intranet thing.
Yeah, just if you want an independent source of counselling, if you wanted it, there's some information there, and you can do the form online.
Thank you.
And sometimes they just do random workshops that you might be able to attend, and it's just an outlet, really, for the kind of work that you do. You don't smoke, your alcohol sort of intake's fine. Yeah. Let's have a look at it.
So it's
just
always
that.
patchy.
Yeah.
So it's there and there. And then
Your face is all right, isn't it?
It's
Backs of
normally
the
around-
knees? Or?
No, I was hoping to give blood next week, but I don't think they're going to let me now, so...
OK. So I'm going to just do a prescription of Hydromol. And at the moment, with the way the eczema is just on the arms, you don't need a strong, potent steroid, maybe just middle of the range.
Yeah.
And I'm wondering if on the same prescription, because I know it's difficult for you to get in, if I just put some 1% hydrocortisone, which is milder, then you can step down.
Yep.
Anything else I can help with?
No, that's great, thank you.
No, fine. OK, so the eczema we'll get on top of, but longer term, we need you in the NHS for a long, 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 long time.
Yeah.
So I need to look after you. OK.
Thank you very much.
That's all right.
great.
Nice to see you, Bethany.
Have a nice day.
Thanks. Take care. Bye.
I've got this
All right.
on my leg.
Yeah.
Now, this is the 3rd or 4th time it's come up. I've had steroid cream. I've had penicillin antibiotics.
Yeah.
It started off as a bite or a sting on that spot there.
Right. When was that?
8 weeks ago.
Was it?
And it's coming up again. I finished the antibiotics last Thursday.
Yeah.
So it's a week, and it was fine, and now it's starting to flare again.
Just have a seat. I'm going to I'm going to come and have a closer peer. So when you use the antibiotics, what happened?
It seemed to get better.
Right.
And then but like I say, it's flaring up again.
So when you use the antibiotics, it makes everything better?
Well, it did do. Yeah, no, it did, yeah.
Yeah. How many courses of antibiotics?
First of all, I put bite and sting cream on
Yeah.
it. Then I had steroid cream from the doctors, and then a course of antibiotics.
OK. Do you get psoriasis at all?
No. I've never had psoriasis, although my mother is riddled with it.
Right, OK. Sometimes with psoriasis, if you are prone to it, and sometimes it occurs in a place where you've got an injury, a trauma.
OK.
And, of course, the bite and the infection may be enough to cause a patch of psoriasis. Sometimes bacterial infections with the commonest thing that causes skin infections called Staphylococcus. So have you heard of those bugs? No. Well, they cause skin infections really commonly. Okay. They can sometimes cause blistering. So it's a little bit of a mystery. I think what I'm going to suggest that we do is the antibiotics seem to work. I'm going to give you a higher dose and a longer course for 2 weeks and then see what happens. But if it's not settling down, we'll see you again. And if it all goes away, then job's done.
Okay.
All right.
Thanks
nice to see you.
Today.
Yeah, no
Thank
problem.
you.
Nice to see you.
Thank
Bye.
You. Bye.
Hi. Morning.
Sorry?
I said morning.
I heard you the first time.
Sorry. Just trying to be friendly, you know. It's just
Yeah,
my
I know,
standard
yeah,
politeness
as you
thing.
are.
What are we talking about today? How are you getting
Heaven
on?
knows. You told me to come back in a fortnight.
Yeah. How have things been?
Well, 4 or 5 days I felt quite bright. And then back again.
Yeah. And there was also the question about starting this new tablet from the diabetes.
I don't know anything about a new tablet.
So the new tablet is designed to try and improve the sugar control. And its side effects are that it may cause you to get some urine frequency, and it can cause urine infections, and it can cause thrush.
Oh, lovely.
And what the guidance is you drink plenty, like loads.
Yeah, I've been drinking lots.
Saying drink a glass of water every hour in order to make sure that you're well hydrated all the time.
Yeah.
But if you're OK with that, we could get this new medicine started.
Yeah.
And hopefully that will bring the sugar levels down. When did we last check the sugar level? Just give me a... April.
Was it? Oh. For months now, I get into bed at night and I get only the top half of me, a tingling sensation in my arms and my chest, and then it just goes away.
How long does it last for?
A couple minutes.
Yeah.
If that.
And every day, every hour, every minute?
No, only at night.
Only at night. And does it kind of shiver over you, or is it?
That's the one.
Yeah.
Yeah.
Okay. And is it all normal when I touch you? It feels normal?
Yeah, fine.
Okay. Just put your arms out in front of you, palms towards the ceiling, close your eyes. Squeeze tight, pull me towards you, push me away. That's lovely. So that's all working normally.
Yeah, it's just an annoyance.
Yeah. How bad is it? When you say it's an annoyance, is it stopping you doing anything? Or
No. Ow. It's just like you go, like that.
Yeah.
I just thought I'd mention I've had it for months and months and months.
I mean, sometimes when you have diabetes, it can affect the way that the nerves work. And this may be that you're getting symptoms linked to the nerves being affected by the sugar, because the sugar coats the nerves and stops them working properly when you get diabetes. And this may be one of those symptoms of
Well,
the
that's what I
diabetes.
put it down to. It's got any worse, it just comes on now and again.
Yeah.
And then...
There isn't an obvious easy fix for it other than keeping the sugar level really controlled. And it would be worth us checking the other vitamins that sometimes cause nerve symptoms to make sure that they're OK when you have your next blood test as well. So
Is there anything I can take to make me feel brighter?
Well, there's not a magic potion, if that's what you mean.
I know that.
Like a tonic or something like that. But getting the sugar level controlled
Such
is the
thing
best
as a
thing.
tonic.
I know.
You told me that before.
Probably did. Well, the main thing is getting the sugar level down.
That saccharin's OK to take with...
Yeah, so that's better than taking sugar, yeah.
I hate sugar, but when I have my Weetabix or whatever, I have a sprinkle of that, and that's OK.
Exactly.
So I don't want to take... I had a big Spassenberg last night, and I was a naughty boy. I know.
Oh, well.
Well...
These are the challenges of life, aren't they, though? And it's very difficult to avoid everything. I do appreciate that.
I'm quite bright this morning.
Good. Well, let's see how we get on with this new tablet. I'll see you in a few weeks' time when we can see how it's getting on.
Yeah.
Maybe a month's time.
Yeah.
All right.
Thank you very much.
See ya. Bye.
Ooh.
Come on in, have a seat.
All right, thank you.
I'm Dr. Graham.
Hi.
We haven't met before.
No.
You're a new patient here?
Yes.
Yes, you've moved from a local practice?
Northville.
Yeah. So what do you think are your main medical issues at the moment?
My breathing.
Yeah, sounds like it, doesn't it?
Struggling the last few days.
Right, so you've got COPD.
Yeah.
Yep. And any other, you've got diabetes.
Well, they think I have, but they think it might be to do with, because I'm on so many steroids.
Right, OK, well, we'll talk about that in a minute. And then, so you have, obviously, home oxygen.
Yeah.
You've got a high cholesterol, high blood pressure. You've had heart disease.
Yeah.
The steroids, what do you think you're on the steroids for?
That is for...
polymyalgia rheumatica.
I can't never say it.
You've got your cholesterol tablets, atorvastatin, yeah?
Yeah.
Candesartan for blood pressure. Then you've got the bone-protecting calcium vitamin D tablet. Lansoprazole for your stomach. Nebivolol, which is for your heart.
Yeah.
Sertraline, antidepressant, and spironolactone, which is sort of a water tablet. In your last practice, they decided that you do have diabetes.
Right, OK.
OK? Have you seen a practice nurse ever for a diabetes check?
I think I've got an appointment with one to see about it.
OK.
On the 8th.
Brilliant, yeah, you're seeing Mike.
Right,
and he's
okay.
actually going to do a check of your heart disease, your diabetes and your COPD.
Shall I bring a packed lunch? OK.
Bring a packed lunch, yeah, not a bad idea. So the bottom line is you've got a lot going on, haven't you? But it sounds like, to be honest, you're fairly on top of it. You kind of have quite a good understanding, I think, of what's going on.
Yes, I do understand.
Really, your heart scan suggests that you've got a little bit of heart failure, that your heart, normally it pumps like this, but it's sort of pumping like that. And that's why you need a bit of help with your fluid, OK? So I'm your doctor.
Yeah.
And we have a system here where we try and get you to see your own doctor as much as possible. If it's a query, then you can book a telephone appointment and I'll call you back. I think we just need to get you to know you a bit.
OK, then, thank you.
Good.
Right.
Great. Nice to meet you.
Yes. Probably see you again.
Yes, I'm sure. OK,
All
bye
right,
now.
Thank you.